take immense pride in driving several public health awareness initiatives through our one-of-its-kind platform, Immunize with Pride. Immunize with Pride is an awareness initiative dedicated to educating in public about vaccine, preventable diseases, and importance of timely vaccination. These sessions feature leading experts from across the country who share their valuable insights on key health topics, aim to raise awareness and promote overall well-being at the society at large. Today, we are delighted to have Dr. P. Swetha Reddy with us to share their expert perspective on hepatitis A and B, the silent threats every parent must know. I'll be sharing more about today's speaker in a short while. For a moment, please allow me to share a brief introduction of Human Biological Institute. Human Biological Institute is a division of Indian Immunological Limited. IL was established in 1982 by National Dairy Development Board and one of its units and was later incorporated as a company in 1999. HBI was founded in 1998 when the Government of India requested IL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. Our first manufacturing facility was set up in Ooty. The facility is one of its kind in India and rolled out the country's first virocell culture rabies vaccine in the year 2000. Today, we are a leader in ARV segment with presence in around 60 countries. HBI has launched several other vaccines and become a major player in human vaccine segment. HBI has been a keen player of pentavalent vaccine to Government of India under its universal immunization program. In yet another milestone, HBI introduced Havishor in 2024, India's first indigenous hepatitis A vaccine aimed at providing protection for both children and adults. HBI has been a key player of pentavalent vaccine to Government of India under its universal immunization program. In yet another milestone, HBI has also introduced Havishor in 2024. India's first indigenous hepatitis A vaccine aimed at providing protection for both children and adults. With the vision of shaping global healthcare by spearheading of the One Health initiative and the mission, the innovative produce and market quality healthcare products and services, and to improve the extended lives. We are committed to providing affordable, high quality products through continuous technical innovations to meet our customer needs. As per the market leader, we have a significant step towards reducing plastic burden by 160 tons per annum through introduction of eco-friendly packaging of our flagship brand, Abharab. As a part of our CSR initiatives, we have adopted schools where IL provides infrastructure support and basic facilities, including assistance with the midday meal program. In association with NDDB through a gift milk program, hundreds of school-going children benefit from daily milk nutrition. We have also donated an oxygen generation plant to Telangana Institute of Medical Science, Hyderabad. These are just few highlights of IL. For more information, please visit our website at www.indieimmune.com. Immunize with Pride is one of our initiatives which emphasizes that vaccination not only protects individuals but also strengthens community immunity. Welcome to today's episodes of Immunization Talk. This session is dedicated to a highly significant topic by Dr. Swetha Reddy. It's my pleasure to introduce Dr. P. Swetha Reddy, a highly accomplished pediatrician known for her dedication to child health care and with more than 15 years of experience. Dr. Swetha Reddy completed MBBS from Kakatiya Medical College, followed by DNB from Holy Family Hospital, Mumbai. Dr. Swetha has completed Pediatric Advanced Life Support course in Mumbai, demonstrating a keen interest in pediatric research. Dr. Swetha has presented a scientific paper on intracranial bleed in hemophilia at Pedicon. Madam is a lifetime IAP member and she's currently working as a consultant pediatrician at Treat.A.Baby Children's Clinic, Hyderabad. Please join me in welcoming Dr. P. Swetha Reddy. We are delighted to have her and share her insights on today's topic. Welcome, ma'am. It's truly honor and privilege to have you with us today.
Hello, good afternoon, Shravani.
Good afternoon, ma'am. Thank you for joining us today. With you are the heavy hectic schedule you have given us a time, and to our viewers and our parents want to get to know about this such an important topic that is on hepatitis A and B.
Correct.
Thank you, ma'am. Ma'am, as we proceed with our session with the queries, like commonly asked queries by our parents, like what is actually hepatitis A and B, and how does it affect the liver?
Okay, so hepatitis A and B are viral infections caused by the virus of the same name, hepatitis A virus and hepatitis B virus. Like the name suggests, hepatitis means hepa means liver and itis means inflammation. So these viruses cause inflammation in the liver. Both are viruses, but the way they are transmitted, the severity, the how short or long term they affect, that is the difference. So the virus lives in the liver cells, and when our immune system wants to kill this virus, it affects our own liver cells. So this leads to inflammation in the liver. And liver is, our primary filtration and metabolic organ. It filters toxins, processes bilirubin, helps in clotting, removal of toxins, etc. So when because of the virus infection, our liver undergoes inflammation, this function of the liver gets hampered, and thus you see all the symptoms of jaundice, lethargy, because the liver is not able to remove the toxins, so the bilirubin accumulates, the jaundice, vomitings, and henceforth.
Ma'am, nicely explained, ma'am, how does the virus affecting the liver and making an inflammation. Ma'am, like how commonly children get affected with hepatitis A and B, ma'am? Like how do they actually get affected?
So, hepatitis A and B, first of all, not very commonly, it's not very easily diagnosable. You can diagnose only when you see jaundice, or child is visibly very sick with jaundice or dark colored urine, clay colored stools. These happen very later. The transmission variation is there. So, hepatitis A comes through hand to mouth, feet of transmission. What does that mean? So somebody with the virus can eats the virus feces, and even microscopic quantities, if contaminated in our food and water, can give disease. So this is fecal-oral, hand to mouth, unhygienic hands. Especially we see in children when they start daycare, when there is somebody has changed the diapers and not followed good hand hygiene, or contaminated hard surface. Children playing with toys, or there is one somebody who is contaminating, and children with toys or inadequate hand hygiene, they get this virus through the hand to mouth transmission. And hepatitis B again is entirely different. The transmission is not the same. Hepatitis B transmits through the blood route, blood or body fluids. So there are two ways hepatitis B comes. One is mother to child, this we call vertical transmission. If a mother has hepatitis, she may transfer it to the child at birth. Birth vaccine is important. So if there is a question, we'll discuss about that. And bodily fluid. Is a child. There is a child with a cut or something, and a patient with a bodily fluid or blood, something with it, or which has the virus, can go through your cut. So something like that. And in older children, we see transmission through sharing of these personal grooming items like nail cutters, toothbrushes, and such things. Okay, so tattoos also we say no. Hepatitis B is important. So that route of transmission is different, and this is how children get the virus.
Okay. Ma'am, it's really clear explanation how hepatitis B and A differ and how they. But as you mentioned, ma'am, there are some signs and symptoms like jaundice. As you said, dark color, clay. But what are the early signs and symptoms of hepatitis A and B in children, and how they are easily missed? Like every child represents with the same symptoms, or sometimes there are the chances of missing their symptoms.
So even though the transmission is different and the severity is different, the modes of transmission is different. The symptom of maybe caused with any virus is the same. So hepatitis is many types A, B, C, D, E. Even though the virus are different and all, the symptoms are almost the same. The reason why they are missed, so what we know is suddenly you will see that the child is yellow and he has very dark color and light colored stool. That is later. So first the symptoms may not come only. You forget about early symptoms. The symptoms may not show up only, especially in hepatitis B. In hepatitis A also, starting from few, the patient may actually be exposed weeks to months earlier. It may take about months in a hepatitis A to even start showing symptoms. In hepatitis B, there is some evidence that forget about weeks or months, it can go decades without a symptom. So imagine a child born to a hepatitis B positive mother may not show any symptoms till he's 20, 30 years of age also. So
Oh.
first it's missed because symptoms may not come only, and number two, the early symptoms very vague, like low grade fever, lethargy, fatigue, any viral infection in a child in season. It may be fever, some nausea, loss of appetite, child is just weak, some muscle aches, even the stomach pain, the right upper quadrant pain also can come very later. And it is when jaundice comes that everybody is alert. And beyond jaundice and this urine, beyond jaundice, again swelling of the stomach, altered sense, abdominal swelling, altered sensorium. We call it TKR dots inside your mouth, which signifies that you're not able to clot your blood properly. That is a sign of failure. So first of all, symptoms may not appear. Second, very vague symptoms like any fever, fever, stomach pain, vomiting, loss of appetite, lethargy, and then this jaundice is where we actually diagnose. And then later it can be fulminant liver failure and so on symptoms.
It's a very new point, ma'am. Like it takes so much time to get like everyone, all the parents, like common people think first sign is jaundice, then it jaundice, we get treated and it's solved. But nicely said, ma'am. So my next question is like, what is the difference between hepatitis A and B in a transmission and severity, ma'am? As you mentioned in the first question only, food and vocal, but we wanted to know what is the severity of A and B, ma'am.
So same hepatitis A comes through fecal-oral route, which is nothing, hand-to-mouth transmission. So hepatitis A is mostly an acute infection. Acute means sort of temporary, comes temporary swelling, inflammation of the liver, and triggers an immune response by the human. And this immune response causes the hepatitis, but clears the virus. This immune response itself clears the virus. I think within 2 to 6 months, I mean, the patient will feel better immediately only, but in a few weeks. But the body clears the hepatitis A virus definitely before 6 months. Long term sequel in hepatitis A, very rarely in a patient with pre existing liver disease or any immune, less than 1% chance of very severe we can see in hepatitis A. So the severity chance is self-healing, self-limiting, no particular treatment for hepatitis A. Yeah, temporary symptoms like we discussed, and resolution will also happen. Even if care is not taken, complete resolution happens. But it is different in hepatitis B. Again, transmission, through blood and body fluids, but the same thing, severity here, there is a risk of long term, there is a risk of chronicity in hepatitis B. So what we call a chronic infection is something which is lasting more than 6 months and can have a lifelong sequel. It can cause, the hepatitis B can cause, so continuously the inflammation happens, and our immune system continuously tries to kill the virus, and then slowly these dead liver cells become scar tissues, which we call fibrosis, and then extensive scarring in the liver can cause decreased blood flow, liver swelling and all, and eventually hepatitis B can become chronic, cause liver scarring and even cellular carcinoma, which is nothing but liver cancer. So yes, so hepatitis A, if at all it is not is severe, resolve completely. But hepatitis B, that it always carries a very high risk of chronicity and lifelong disease, if not cancer. Yeah.
Ma'am, as you mentioned, like hepatitis A is like fecal-oral, and everyone eats out nowadays. So, are they at risk? And is this vaccine preventable diseases both A and B?
Yes. So, like you rightly said, hepatitis B, the transmission is through blood and all, and if maybe needles sharing is not happening, or the air through the blood is not, nowadays everybody yes, eats out, and it is food, and virus is very heat sensitive. With mild heat also the virus dies. So again, same thing, heating, eating good food, washing our vegetables, with and clean water is important. But if at all our even without food and water, even if our hands are not hygienic, it may come. Vaccines are available for both. So first, the misconception happens that the government of India in its universal immunization program covers hepatitis. So sometimes I have parents telling me that hepatitis is done, hepatitis is done. It takes me some time to explain them that hepatitis B is done, A is not done. A is not given in a universal immunization program, but UIP, but we give it. So we give both A and B. So yes, we have vaccinations. Like we discussed, hepatitis B can pass from mother to the baby. The first vaccination of hepatitis B is ideally given within 24 hours of birth. And then, according to Indian schedule, we give second dose and three dose within 6 months. So three doses of hepatitis B before 6 months. So how we at birth, and usually at 6 weeks, 10 weeks, 14 weeks, we give hepatitis B, and that's it. This confers lifelong immunity. This is hepatitis B, but hepatitis A, like we discussed, it is not blood route, and usually it comes when children start to mingle with other children in daycare, or they start eating outside food. So hepatitis A vaccine, the first dose we give around 12 months, and second dose, this is only 2 dose schedule. The second dose we give 6 months after the first dose. So before 18 months to second birthday, we finish 2 doses of hepatitis A. So both have vaccines.
Okay, ma'am. Like clearly explain the dosage
Yeah.
and the vaccination schedule, ma'am. As you mentioned, like this disease is like especially severity is more in B. But why hepatitis is called a silent infection, ma'am? In especially infants and young children, A and B.
Yeah, so like I told, sometimes it can take decades for the symptoms. So why does it take decades? If the infection occurs in infancy. A infant means a child who is less than 1 year old. If he contracts the infection, it can be very silent, and by the time you see a symptom, that the liver can already have scarred. And why is it so? Is because of the developing immune system of children. An adult, if an adult gets infected with hep B, the immune system aggressively attacks the virus. The symptoms come off very fast, and whatever happens quickly. But the immune system of a child is still developing. Okay, so it really doesn't fight the virus as aggressively as an adult. So the silent infection happening before you see the jaundice. So that's why Hep B is silent. So we cannot say, that at 30 years you see somebody with scarring in the liver. There is no guarantee that he's gotten the infection that time. He could have contracted the infection years ago. It's because of our immune system. The children's immune system doesn't aggressively fight the virus.
Very well explained, ma'am. And I guess our viewers are getting a clear idea about the hepatitis A and B. So, ma'am, my next question is like, as you already mentioned, but we want to know about the long-term complications of A and B if it is left and untreated.
So hepatitis A, like we discussed, it is temporary. Usually when we diagnose Hep A, the care is supportive, and even if that supportive care is missed, usually the healing occurs. See, if the child is very dehydrated or vomiting severely, very high grade fever, the complications of that is different. We need
Yes.
to give good supportive care, but the liver per se long term sequel will not be there unless there is a fulminant hepatic failure which can cause death itself. Okay, so that risk is still there. But Hep B has long term complications. Like I told you, silent inflammation happens till your liver starts to actually swell. Patient may not even feel stomach pain. By the time diagnosed, the liver can go into, so these are the long term. So liver can already go be fibrosed, maybe cirrhosis may happen. So when the scarring happens, liver will not be able to process, let the blood flow go properly. It affects issues, it purifies our bodies, like it sort of detoxifies, right? Bilirubin management by the liver, clotting will to definitely be affected because the primary function of the liver, but the liver per se is affected. It can cause ascites, it can cause hepatocellular carcinoma. This is the major thing for FB. It can cause cancer, HCC. So this is what is the long term main sequel, but it can even affect our kidneys, our blood vessels as well. Hep
Okay,
Yeah.
ma'am. Thank you for explaining this so well. Ma'am, my next question is like, as you mentioned, hepatitis A is a fecal-oral and hepatitis B is through blood transmission. But totally, if it is fecal-oral and the hygiene practices are maintained well, is this a disease completely prevented? And what is your
No,
opinion on
many
this?
many say that they know that my child doesn't eat outside food at all. My child, I sanitize, I maintain at home. But see, your child is going to school. You never know if somebody is carrying the virus, and it comes through shared surfaces also. Hand. You know that the water is always pure. These children attend school, they go to play areas. So without vaccine, just by general care, I am going to prevent. The chance is still there. Only vaccine is 100%. Vaccine can prevent the disease 100%. Can try, but then we cannot guarantee 100% just because you're hygienic. Yeah.
Yes, ma'am. Thank you. Then, ma'am, next question is, when should a parent seek medical attention if they suspect their child with hepatitis?
So usually they seek only when they see jaundice.
Correct.
But yeah, like I said, see now in the era of doctors, good doctor availability, and parents already know that over the counter. I think at least 2 3 years before, parents used to sort of approach and sort of and take few medicines and self treat for a couple days. I don't think anybody does it. So generally, a pediatric consult needs to happen if your child has fever, stomach pain, vomiting, loss of appetite in general. But yes, the consult usually for hepatitis happens when they see jaundice. But jaundice again can be a later stage. So the moment your child has fever, especially prolonged with no reason, you see that the child is febrile for a week or two. You already thought of viral and you've treated, but still you want to, and still the loss of appetite is there, lethargic child fever. This stage to doctor is much important than approaching when jaundice is already set in. Yeah.
Thank you, ma'am. My last question for today, ma'am. What are the most common myths and
One thing, sorry, and one thing, so this is they should seek medical attention, right? Now, one thing is when somebody has hepatitis. So, like we discussed, no, the child may not have any symptoms, but you come
yes,
to know that your neighbor, somebody got jaundice, they got affected with hepatitis A, or whatever. You know that somebody has got hepatitis, and that person has come in contact with your child. So even if your child is asymptomatic, seeking medical attention is important.
yeah, very well said, ma'am. Seeking a medical advice is much important than
No, no,
ignoring, ma'am. In your yes, ma'am.
yeah.
Ma'am, in your regular clinical practice, there would be some common myths, misconceptions about hepatitis A and B that every parent should know, and you want to share it in our platform. Please do share it, ma'am.
Yeah, so the myths being the same thing, now recently there was a thing, some countries are not wanting to give the birth dose of hepatitis B because they feel it's causing some behavioral issues. No, that's not true. We are going to benefit if you don't vaccinate a child at birth with Hep B. Like we told, this child can have lifelong complications. So vaccination of with Hep B at birth is of importance. And again, same thing. Hepatitis. There is not one vaccine. There are two: hepatitis B vaccine, hepatitis A. Parents think there is only one type of hepatitis B vaccine. It's the same thing. No, hepatitis B vaccine is not going to protect against hepatitis A. Two separate vaccines are required, and then again transmission. So many people think people who use needles or drugs only they can get hepatitis B. No, it can transmit through mother and child and through blood, etc. So yeah, it's not only needle transmission. And what else, like breastfeeding. So like we discussed, if the mother is hepatitis B, we know that's not correct. If the mother is Hep B positive, the child should receive not only even immunoglobulin, the Hep B immune globulin at birth, and can safely breastfeed. There is no contraindication to breastfeed. This is one thing parents ask me. And again, the same thing. If your child doesn't have a jaundice, doesn't mean your child doesn't have hepatitis. So, like chronic inflammation can go on. And one thing is that sometimes they think there are two ways. Okay, these Ayurveda or herbal medicines sort of come into the picture in this. There is one group which think that these things can cause hepatitis. Like we took some this medicine for 6 months and this has caused hepatitis. So that is also a myth. But
Hmm.
again, at the same time, we see when somebody comes with hepatitis, we are going to go for herbal treatment.
Correct.
Two things happen. So yes, see, of course these herbal treatments can have heavy metals and actually cause liver issues, but hepatitis infection, Hep A infection, Hep B infection is due to the virus. And unfortunately, if you get it, please don't go for herbal. It's just basically supportive treatment only which matters, and prevention, that's all. And again, last I think the diet. I think when you diagnose and we discharge and send, the parents feel, the liver, we need to detoxify the liver, how, by hook and crook, and they give all, the healthiest possible bland diet, boiled diet. They don't put anything, no salt, no sugar, no spice, no outside food. So I think all this care should happen before. So after the disease to sort of trouble the child is not correct. A child with hepatitis is anyways going to be, not wanting to eat and drink, and putting dietary restrictions is not. Any homemade, well cooked, well washed food which is fresh, likes, can be given in hepatitis. Yeah. So these are some. Yeah.
It's very well explained, ma'am. Like very well said. Also, like how diet is also very important. Thank you for saying this, ma'am. We have set of questions from the viewers. My first question is like, can my child is 2 years old? I haven't taken hepatitis A vaccine. Can I take a vaccine?
Yes.
Can
Yeah. Even adults can take Hep A vaccine, even Hep B vaccine. So it depends if no dose has been given. It's Hep A is 2 doses 6 months apart, and you can take it. And 2 years is good enough. Like, we have many parents who get to know that Hep A vaccine is available and come in at 2 years. That's also fine. You can take.
Ma'am, if child has a cold or fever, can he or she take a vaccine?
So not only hepatitis, any vaccine, if the child has fever, do not give the vaccine. If the fever is there 2 3, a child with fever or within 24 hours of fever interval, please don't give the vaccine. Mild cold, cough, vomiting, loose motions, these are not contraindications, but fever per se better to avoid for a couple of days. Yeah.
Yes. My next question is why my child get fever after vaccine?
Hmm. So yeah, so it is okay. It is okay to get, okay. Many myths related to it. So will my child get fever? So what happens? Let him get fever. You just think that the vaccine is working. But again, if the child doesn't get fever, they'll feel the vaccine is not working. So yes, fever after a vaccine. So like no, like the DTP, the pertussis vaccine, the whole cell can cause a lot of fever. The acellular may not cause fever. So not only that vaccine, any vaccine can have the vaccine or the needle related fevers. So that doesn't have any effect on the vaccine efficacy. And be prepared that the next 24 hours after taking vaccine, if you have fever, you can give paracetamol. That's not should not be a factor where you should deter the vaccine. Yeah.
Yeah, thank you. Thank you. This is like all set of questions we got from the viewers, ma'am, and you have explained it very
Okay.
well. We hope today's session was informative and valuable in spreading awareness on today's topic. Thank you so much, ma'am.
Thank you. Thank you for giving me this opportunity.
Yes, our special thanks to Dr. Swetha Reddy for sharing her time, expertise, and insights with us today. For those who would like to revisit the program, the video will be available on our social media platforms. Please follow us on Twitter, LinkedIn, Facebook, and subscribe to our channel, YouTube channel. Do share and spread the word to as many, including your friends, family, and relatives. Until we meet in our next live talk, stay healthy, stay aware, and please take good care of yourself. Thank you so much, for you, ma'am, for having us today.
Thank you, Shravani. Bye. Take care.
Thank you. Bye, ma'am.